Hello everyone, welcome to Field Notes, an exploration of functional medicine. I'm Rob Downey, a family practice MD and Institute for Functional Medicine certified practitioner. I'm coming to you from Seaworthy Functional Medicine in Homer, Alaska. Seaworthy exists to help people overcome their health challenges and be fully vital. Today we are fortunate enough to be joined by Dr. Natasha Fallahi, a doctor specializing in autoimmunity, Hashimoto's, and the dimensions of being intuitive or empathic and how they can tie in. Welcome, Dr. Natasha.
Hi, thank you so much for having me. I'm excited to have a conversation with you today.
Well, it's great that you were willing to give us your time. So I want to try to summarize your bio, and please add to it or recharacterize it if need be. So you're coming at this as a trained doctor, and then you're also you have coaching certification in autoimmunity,
Mhm.
and you have programs where you work with people on autoimmunity, Hashimoto's autoimmunity, mood,
Yeah.
and then how, if people are intuitive or empathic, or if they resonate with that as a characteristic, how that impacts all of this. Is that accurate?
Yeah, definitely. I guess my specialty or my niche is really autoimmunity and Hashimoto's, and in particular because I've experienced those personally, and I've gone through a healing journey, and I've also led loved ones like my mother through them, because we had a lot of similar characteristics. But then I found that most of the clients that I was working with had similar journeys as well, and it just became really interesting to me that there was this connection that I was seeing between people who had autoimmune conditions and Hashimoto's, celiac, and a lot of these autoimmunities. They also had incredible sensitivity, whether that was sensitivity in their body, sensitivity in their mind. And I've always considered myself a sensitive person. So
Mm-hmm.
it all came together for me there. And that's sort of why I am the sensitive doctor now, because to me, that's a bigger underlying thing than necessarily the diagnosis or
Mm-hmm.
the label that someone's been given.
Mm. This is so interesting. So how did you develop your approach? How did you, well, this must tie into your story, right? But
Yeah.
then it segues into how you developed your approach, because there's two things happening. A lot of my audience, and again, I thank them for joining us, they've heard that autom- thankfully, Hashimoto's and the accompanying hypothyroidism is reversible for many people, or we can mitigate it.
Yeah, definitely.
And I think our audience loves the good news that they've heard something's reversible, and or they've heard it's irreversible,
Yeah.
and then with functional medicine they can move forward. So yeah, if you'd illuminate for us how you healed, and that particular dimension of being intuitive or empathic, how that affected what you do, that'd be great.
Yeah, definitely. So my story's, I guess, kind of an interesting one in that I never set out to be a doctor. Like I never started out on this path. I actually had always been in the arts and had planned to go into the arts field. And I mean, as you can see, I have like paintings around, I've got my easel and everything. It's still a big part of my life. But as I was an undergrad and I was studying graphic design and arts, I was falling apart. My life, my ability to function and show up, just it was really getting to that rock bottom place. And for me, I didn't know it had anything to do with autoimmunity. I didn't know it had anything to do with Hashimoto's, celiac, any of these other autoantibodies that I had in my body. It manifested for me as severe depression and extreme anxiety.
Mm,
So I started having massive anxiety episodes and depression to the point where I had given up on a lot of things that mattered to me. And I thought that those characteristics of being a little bit moody or depressive or kind of like anxious about my environment or people or social situations was my personality. I thought it was my
mm,
disposition, that I was an artsy person, I was emotional, I was this and that. So as it turned out, a lot of that spoiler alert, a lot of that was caused by inflammation in my body. So when I had this rampant inflammation going on, as you've talked about in the gut, or, in neuroinflammation, these sort of things where my immune system was really dysregulated, it was manifesting as symptoms of me being hypersensitive to my environment, like reacting to environmental things or allergies or foods or skin issues. But again, this kind of emotional cognitive stuff where I couldn't focus, I had depression, I had like actual panic attacks multiple times a day for a period of time. So that's where my journey into this field started, and how I learned about all of this and how I became the sensitive doctor is I went through this experience where I sort of was just having mystery symptoms all through my life, like childhood, teens, early 20s. And then when I was an undergrad, I hit rock bottom. And to me, that's the common story of someone who's on an autoimmune journey. They often will just have mystery symptoms. And then they'll reach a point where things fall apart for them. Like they either can't function as, in their job or as a student or as a, wife or whatever as their roles. So that's where I started seeking answers. And I went to every specialist. I went to every doctor being like, what's wrong with me? And they all looked at me as this, at the time I was in my early 20s. I looked okay on the outside. Like knowing now, sure, I might have had like bags under my eyes or like acne or things like that, that people just think is normal.
Mhm.
Um, that I knew was, something bigger was going on. But for most of the doctors that I went to, they all told me that I was making it up. They're like, you're young, you're fine, you're healthy, like take these antidepressants and go on your way. And it was really like I still kept seeking why. And so that's what really led me to alternative medicine, integrative medicine, holistic medicine. And that's where I started seeking consultations from all other practitioners and getting their perspective on what was going on. And that's where I fell into the world of kind of mind body medicine, understanding how we hold stress in our bodies, understanding how food impacts us. And so, long story short, that took, over a decade of me going through my healing
Mm.
process that led me to get my doctorate, realize that there was such a powerful way of looking at the root cause of things and looking at where those imbalances are rather than just symptom management or symptom suppression. So that's how I learned about functional medicine, learned about mind body medicine. And, I think how, to tie back what you're talking about, sensitive people, empaths, those people is like, I have always been a highly sensitive person and an empath, and I felt things in my body. So even if somebody would look at me and say, oh, you're fine, there's nothing wrong with you, there was a voice inside that I knew something was speaking to me, or there was something imbalanced. And I think that that's a commonality that I find with most of my clients is they really have a strong intuition. They have a voice that speaks to them about what's going on or the environment, and they may not know exactly what the answer is, but they
Mm.
have a curiosity and they're seeking a bigger understanding. So
Mm.
that's kind of like, long story short, how I shifted gears from the arts career because my life had fallen apart. I found answers and I found healing through alternative and functional medicine. And then it just changed my life. And I thought, I can't not learn more about this. I can't not um,
Mm.
teach this to other people. So
Yeah.
that's how I'm here today.
Yeah. Wonderful. Wonderful. Well, tell us then next, if you would. So, how do you find Hashimoto's? What makes your practice specific about how you find and treat it? And then after that, let's add that layer of what you counsel people about the consequences of being empathic or intuitive.
Yeah, definitely. So Hashimoto's is one of my specialties because unfortunately it's one of the most common autoimmune conditions. And there's actually a research study done, I think it was in 2006 or something. I don't have it right in front of me right now, but they found that of the people that they studied who had hypothyroidism, who were just diagnosed as hypothyroid, 90% of them actually had an autoimmune root cause. That was so it's being missed a lot of times for people who have thyroid disorders, because it's not being screened for. And so because it's so common, and because it's one of the often the first um, auto antibodies that develop for people, especially for women, it's for me one of the best places to start, because I caught mine early and I had Hashimoto's antibodies, but I also had like GAD65 and you know, like all this celiac, and I had
Mm.
I had a lot of other antibodies, which I don't
Mhm.
really need to go into, but it's a
Mhm.
cascade that happens in your body, right?
Mhm.
So you could take each one of those tissues and add a label to it and say, I have this disease, I have this disease, I have this disease. But with autoimmunity, when you look at it holistically, really it's dysregulation of the immune system. So if it's getting dysregulated, and one of our most sensitive organs is our thyroid, and that's one of the first ones to start, you know, going out of balance, tagging itself with autoimmune antibodies, it's, you know, I like to start there because it's one of the best places to screen things for clients who maybe don't have answers. You know, they're just
Mhm.
like, I have low energy, I'm fatigued, I'm losing hair, I have skin issues. Um, Unfortunately, because of how common Hashimoto's is, if we look for that, we can get a big answer in terms of like starting to shift the way they're addressing their health. So that's one of the main reasons why I focus on it. And also because I've effectively like put my Hashimoto's into remission. I helped my mom, who was hypothyroid for up to 40 years, when she was really actually Hashimoto's. So when we switched the management from hypothyroid to Hashimoto's, her health improved drastically. So you know, it's because it's like one of the most common, and it really affects the type of people who are sensitive, and the same sort of symptoms where you have like fatigue, you get drained easily. You might be sensitive to sounds or chemicals or smells in the environment. These are things that we commonly see with early stages of autoimmunity, right? You're losing
Mhm.
integrity in your barrier systems. You're
Mhm.
starting to lose the ability to distinguish self from non-self.
Mhm.
Um, and so when somebody comes to me and they don't necessarily have an answer or a diagnosis or a label, but they've identified with being really sensitive their whole life, that's one of the first places I like to start screening, is looking at that kind of, you know, overall balance of what's going on with their body, and making sure that their thyroid is in balance there. Another really interesting thing that I want to add to this, when you ask about people who are sensitive, is that those of us who are highly sensitive people, or empaths, or even introverts, you know, there's all slight variations in these labels, but kind of these category of people, we tend to, you know, pick up on a lot in our environment, whether that's an emotional, you know, stressor, or just an emotional energy, or kind of the vibes of people around us, or you know, even just sounds or lights or things that are just in our environment. We pick up on that a lot more than somebody who's not an empath or who's not highly sensitive. And when you think of that, it's just like more information. It's more to hold and to take on. So it's going to drain your nervous system a little bit more. It's going to put you into fight or flight a little bit more than somebody who's less aware of the environment.
Mhm.
Um, it's going to drain your adrenals a little bit more. It's going to have that whole, you know, stress physiology impact. And so I find that people who are more sensitive often are like, they're just carrying more weight from the stresses in their life, and this can then impact or imbalance their immune system and their hormones faster than somebody who's a little bit more kind of like oblivious to what's happening.
Yeah.
Does that make
Yeah.
kind of sense how it's related?
Yeah. It does. I like all the dots that are connected there, and I've noticed in my practice that it's so, now a lot of people come to me and they say, I want a broader, deeper thyroid test. Just
Yeah.
visit number one. I know that the patient's saying they want that.
Awesome.
So seeing a tighter cutoff range for what's an acceptable TSH or the free
Yeah.
hormone levels themselves or the thyroid antibodies
Mm-hmm.
is so, it's such a relief to them to have that looked at. And it's such a
Yeah.
relief to them to hear that managing their stress restores gut barrier integrity, which decreases autoimmunity. So they're also getting off that train. They want to be off of, one pill for every ill in terms of
Yeah.
medications. And then it's helped so much also knowing a bunch of these folks who are stressed in the way you're describing, that the adrenals and the thyroid kind of rise and fall together.
Yeah.
So I feel like I'm doing a better job now when I'm looking at both at the same
Yeah.
time. Is that
Yeah.
part of?
Yeah, definitely. So, I mean, I love having those kind of objective views and those tests, like running an adrenal stress index or a full thyroid panel and looking at,
Mm-hmm.
because, and I'm sure you talk about this with your clients and maybe on other podcasts you've done, but, the TSH is just measuring the signal from the brain to the thyroid, right? That's just like the first step of our thyroid physiology. So when doctors are only measuring TSH, and like you mentioned, the range is like much larger than it really should be. It should be a much
Mm-hmm.
tighter range.
Mm-hmm.
But then when they don't run the full panel, like after our brain signals to our thyroid to produce T3 and T4, those start circulating, right? And T3, like lighter fluid, right? It just gets burned up right away. It's what we use for energy. And the T4, it's packaged and it's supposed to circulate and get converted to T3 to be used in other tissue, but it gets converted in our liver, in our gut, in our, like throughout our whole body. So if we don't have optimal function in our liver or our gut, or, we don't have the proper minerals or the enzymes to do this, and your doctor's only looking at this signal, then they're not looking at the end of the day, have you converted all your hormone? And are you still, like, do you have enough hormone at the end of the day? Or your other organs functioning properly? So,
Mm-hmm.
I love that you're saying people are coming in asking for that deeper look into their
Yeah.
whole thyroid physiology rather than just the first part of it.
Yeah, that's certainly what I flashed on when you mentioned that. Though, admittedly, there's another really neat clinical experience, which is the person who's just saying I'm wiped out, and
Mhm.
um, they. One thing I love about this topic of intuition is that it's so striking to me how commonsensical functional medicine is to our patients.
Yeah.
So when I transitioned into it 15 years ago, I thought, oh, well, there'll be all these detailed explanations of why come on board.
Yeah.
And most of my patients were just like, you can skip that part. This is common sense to me. I've been expecting somebody to finally say
Yeah.
root cause.
Yeah.
Like let's do a root cause analysis of
Yeah.
where
Totally. I
this
mean,
comes from.
it does make sense. Like when there's a problem, why wouldn't you want to look for the root of that problem? And I think that's, what I described in my early healing journey before I knew anything about medicine or health or any of that. Every doctor I went to, they like, that's essentially what I was asking them. I was like, can you do a large screen of everything and let me know what's balanced, what's not balanced, and
Mm-hmm.
help me find that root cause? But I didn't have the terminology around that, right? And I didn't know
Mm-hmm.
what to request. But
Yeah.
it was crazy disheartening to me, kind of like the general Western conventional approach where they're really just like looking, like they ask you what your symptom is. They might screen for one or two things based on what you report as your symptom. And then if that falls within a range, they're either like, well, we can either suppress it or increase it. And that
Mm-hmm.
doesn't make common sense to me. Like to me, it's like, well, let's take a bigger look at the whole system and how they're all working together. So I love, people who walk their patients and their clients through that. That's kind of the process where it's like, I'm not asking them to come to me and tell them and them, tell me what to look for. That's our job,
Mm-hmm.
right?
Mm-hmm. Right. Right.
To
You.
like do the questioning and say like what has been going on and look at the history and do the assessment. And then there's that. So another thing that I often use to describe in terms of my approach of addressing autoimmunity or like any sort of chronic health issues with sensitive people is I really love the metaphor of the yin yang from traditional Chinese medicine, where we have, the yin side is more the traditionally feminine, receptive, kind of intuitive approach to things, and the yang is the more traditionally masculine, action oriented, logical, rational side of things.
Mm-hmm.
So when I look at that and I look at my healing journey and my approach now, I really see the yang side as functional medicine. It's like very much investigative, like let's take action, let's get data and objective
Mm-hmm.
markers and like look for what's going on here and then come up with
Mm-hmm.
a plan, right? Like
Mm-hmm.
lifestyle plan, supplements, diet changes, these sort of things. Um,
Mm-hmm.
and that's so powerful. And it's really effective. What I find a lot of times with sensitive people or people who are really depleted, who don't quite have the vitality yet to take on all of that, if we start or we balance that approach with the yin, which to me is more the receptive, intuitive type of medicine, it can help replenish someone's energy to get them to the point where they're ready to make diet
Mm-hmm.
changes or,
Mm-hmm.
do these kind of investigative processes. So with my healing journey, I was so depleted that one of the first places that I started was with body work, with like actual somatic alignment, chiropractic work. And that really helped rebalance my nervous system, shift my physiology and my neurology from like sympathetic to parasympathetic. And it
Mm-hmm.
allowed me to gain a little bit of hope and energy so that
Mm-hmm.
then I could say, okay, now I'm ready to like remove the processed foods from my diet
Mm-hmm.
or things like that. So I really love that like yin yang balance of taking action and investigating and knowing things, and then the yin side of like receiving care and trusting your intuition and kind of like surrendering a little bit, not always being like I have to fix this, if that makes
Mm-hmm.
sense.
Oh, yeah. I think it's so important what you're saying, and I'm really glad our audience is getting to hear it because it mirrors something that I've witnessed in 15 years of functional medicine,
Mhm.
which is it came into the tightest focus when I had two functional medicine certified health coaches on my team. So the nursing and patient services folks were also certified by the Functional Medicine Coaching Academy.
Yeah.
And so one piece of data that came out of, I don't know if it was Harvard or something like that, but one of the big institutions that was studying coaching,
Hmm.
they had data that if the doctor hands somebody a food plan,
Hmm.
actual translation of the food plan to clinical success, whatever the target condition is, like 1 in 20.
Mm.
But then they contrasted that against a person who underwent coaching, and the coach said, who are you? What do you believe? What's your palate? What's your pantry, et cetera? And often the coach would find out, well, this person's tired and overwhelmed.
Mm.
So the first step isn't to make a recipe every day from the Institute for Functional Medicine
Yeah.
detox food plan. The first step is 4 square breathing,
Mm.
just 1 minute of relief
Yeah, it's
from,
huge. Yeah.
what Heidi Hanna calls the grind and the hustle, right?
Mhm.
Um, and so I started really noticing that trend then that um, the yin is a lot about the how or the context
Mhm.
paired with the what of
Yeah.
the yang.
Mhm.
And I would say my outcomes went way up when I
Yeah.
was not only able to talk about lifestyle, but just people getting into a clear-eyed space of who they are and what they want.
Yeah.
And it seemed like then the patients were projecting forward that they needed to get the labs back and do the plan. But as soon as they took those first deep breaths and kind of just uh, had a sense of peace, that's where their healing journey actually started. That's how it feels to me when I witness it.
Totally. Yeah, I love that. Yeah, and that's so fascinating too. You said they've like done research on seeing kind of compliance or positive outcomes with that, but um, I think that for me that came from just being the patient. Like I went
Mm-hmm.
through this process myself, and
Mm-hmm.
um, when you're at rock bottom, it's I know from being there that you just want to get through the day, like
Mm-hmm.
ideally like yes, you want to like improve your lifestyle and change all these things, but really at that time, and in, you know, another metaphor that one of my mentors uses is what he calls below the horizon and above the horizon. And when you're below the horizon, you're suffocating, you're really struggling to kind of get by. And it is very focused on your symptoms and your pain. And there's
Mhm.
nothing wrong with that. Like if you're in that place, you're in that place.
Mhm.
And I remember being there where I didn't want to wake up the next day, or I really had no reason to want to eat another meal. And so for people who are in that place below the horizon, they need a completely different type of approach that definitely has a lot more empathy and a lot more, you know, just awareness, a lot more sensitivity to their context, like you said, like
Mhm.
where they're at. And then, you know, kind of as people get better and better, they reach this area where we kind of call the horizon, which is just like normal, like you're functional, you're doing great. And that's when people start to realize, wow, if I keep doing these things that got me to the horizon, I can actually feel better and better and better. And that's when you get the above the horizon phase, where people start to really achieve wellness, like
Mhm.
optimal vitality. And so
Mhm.
I will always walk my patients through this. Like the assessments that I put them through involve this objective stuff, like the Yang stuff, where it's like, well, let's look at blood markers, let's look at stool testing, let's look at, you know, adrenal
Mhm.
hormones and things like that. But I also put them through kind of like emotional or like just experiential assessments to see where they are. Like, are they at rock bottom? Are they at the root cause healing phase? Are they just kind of in mystery symptom? Those are like you know, I have this 4-phase autoimmune journey. And then we also have like a chart where we actually map out where they are day to day, like above or below the horizon, and what
Mm.
that pattern is.
Mm.
And so it really also helps bring perspective as someone's going through the healing process. If they have like a bad week, I know going through the journey myself, sometimes you get really disheartened and you think, wow, this sucks. I'm always going to feel in pain. I'm always going to feel terrible. But if you can kind of see on this chart, like how much above the horizon you are, you just had like a little dip,
Mhm.
it gives you perspective that it's like, oh, I used to feel this much worse.
Mm.
And
Mhm.
so it's, you know, really like, yeah, the idea of context, I think, is a perfect word to describe this, but meeting the person where they're at and providing them with the tools that will best serve them at that place in their
Mhm.
journey. I
Mm.
think it's a really important part of success in terms of people's long-term outcomes.
What a great tool, because it it answers a question I think that I was about to ask you, which is that person, when I talk to or take care of people who are below the horizon,
Mhm.
they're afraid often that
Mhm.
they're going to stay there.
Yeah.
And something that I feel an incredible sense of poignancy about is that um, there's a distortion then of their perceptions depending on how severe or how long they've been below the horizon,
Yeah.
where it kind of feels like it's always going to be this way. I'm never going to get better. And it, you know, it feeds itself.
Yeah.
And so your graph, when I think about what it would, you know, it's just implicit in that they're going to get above the horizon again. That's an objective
Yeah.
observation. And so I would think then they can start a self-fulfilling prophecy then, right, of expecting that.
Totally. And I think that's kind of the idea for me. Again, I never like planned to be a doctor. I never really thought I was going to be leading other people through these health struggles, but for me, I mean, the Latin root of the word doctor is teacher. And so that's really the way that I approach it is I really want to teach people tools to
Hmm.
understand where they're at and what would work best for them and empower them to learn those tools and to explore things, like have that kind of critical thinking or that curiosity, and me really just be kind of like that collaborative teacher with them in the process.
Hmm.
But yeah, that's the idea, is that you once you can see the big picture of it and you can speak with people, check in with people who have been on the journey, they're further along on the journey, um,
Hmm.
it can change the entire approach and your ability to kind of move forward and the outcomes that you can reach. Because I think that one of the most tragic things is when people are told that things are irreversible, that they're degenerative, that, I think that's
Mhm.
tragic. Sometimes I think it's even criminal, because to say that to someone, especially as like, I guess, this authority figure in the healthcare field, and to say someone that there's no hope, this is it for you, is extremely detrimental, and it's powerful in terms of what somebody's outcome could actually be. And
Yeah.
there's things we understand about healthcare and about our immune systems and about diseases and just health and wellness, but
Mhm.
there's a lot we don't understand. So to leave a little bit of that possibility open for people to
Mhm.
have the potential to grow into, I think is one of the most powerful things that kind of mind body medicine offers people,
Yeah.
is that understanding that there is potential.
Yeah. I hear you on that. I think it's worth adding some things I saw along the way. One thing that really strikes me is that uh, my MD training had this emphasis on that I had to master the MD toolbox
Hmm.
or I might harm someone.
Yeah.
And so one of my premises is that, and I'll only speak for myself here, but in subtle ways, I've done some of the things that we're talking about when I didn't know that something could be reversible.
Mm,
At that time in that moment, I don't think that I said it in a callous or insensitive way,
yeah.
but I didn't know that it was reversible.
Yeah, totally.
Um, and so I guess I've developed for compassion for myself and for the doctors who say those sorts of things, and I'm mainly relieved personally that I get to be on the side of the equation where I know how plastic
Yeah.
and reversible things are. I also really was struck by the work of Larry Dossey, and I don't know if you've ever
No, I'm not familiar.
heard about him. He's an MD, and I don't know how active he is now. When I was learning about his research, he was really fascinated by, in a non-denominational fashion, just that doctors who prayed with their patients had better outcomes. And so he did studies on it. But one of his books was on when the patient hears from the doctor that they're not going to get well. He wrote a book how that's an inadvertent curse,
Yeah.
which I think is part of what you're mentioning. And so he mostly spent a lot of his career invoking this idea that when people come to us as a leader,
Hmm.
our words have just incredible
Yeah.
power. And so I've shifted to, if I don't know, I just say I don't know.
Yeah.
You
Yeah.
know, I don't know what's going on, but I want to figure it out. And I think
Yeah.
there's, many paths forward, and I've witnessed so many kinds of healing. That's what I want for you.
Yeah.
And I feel personally good in that kind of relational healing space. And the funnest thing of all to me is when I feel like, oh, I've seen 50 cases like yours. Like, I feel really good about this case because, this combination of low free hormones and a
Yeah.
suboptimal TSH and antibodies, and you're not on your food plan yet, and you're all fired up to start
Yeah.
your yoga class, like you're gonna do well.
Yeah. Totally. Yeah. Yeah. And I really appreciate you kind of even acknowledging that where you've been in your process of your medical training. And I don't say that everybody who, doctors or whoever make these statements, I don't think it's from a place of malicious intent at all. I think it is what people are taught, right? But a lot of times with healthcare, or any field that's just like a very large field that's changing all the time,
Hmm.
not everybody who's working in that field continues to educate themselves or continues to like stay curious or ask why
Hmm.
or what else could I learn or is out there.
Yeah. Oh
So,
yeah.
I think sometimes it's just like some people learned things and that's what we understood at the time. And I don't know, maybe it's a personality trait too. Like I ask why about
Yeah.
everything.
Right, right, right. Well, I want to explore it just a little further because I think this issue of curiosity and why would some of us in the healing arts just keep going on that curiosity and some not. Part of it, I think, has to do again with a conservative MD culture of safety at the expense of curiosity later in the career.
Mm-hmm.
Another is that Jeff Bland's book, The Disease Delusion, Dr. Jeffrey Bland, the father of functional medicine, talks about how when penicillin came along, the whole MD community started seeing this one disease, one fix
Mm-hmm.
solution,
Yeah.
a drug for every bug.
Yeah.
So these one-to-one associations really cropped up. But I think that it's, again, the one that just blew me away was that Jeff Bland, his memory is so good for all the studies.
Yeah.
Over the 35 plus years that he's lectured, anyone in the audience from any background can ask him about a topic.
Mm-hmm.
And so he'll just say to them, well, what are you interested in? Because they'll basically challenge him on, integrative and holistic principles.
Mm-hmm.
And so he's very polite and positive, no surprise, big-hearted, super smart man. He'll say, well, what do you do? I'm a cardiologist. Well, what are you interested in? Heart rhythm issues. Well, Mayo Clinic Proceedings, 2009, the
Wow.
DHA component of omega-3 fatty acid decreases deadly dysrhythmias in Italy in a study of 2,500 people in the cohort, right?
Wow.
And so his the observation was that we look for what we're taught to
Mm-hmm.
expect.
Yeah.
So unless we break the reiterative cycle that we're only looking for the drug studies.
Yeah.
So I have found in functional medicine, now I'm aware of this whole body of research
Mm-hmm.
that was right there.
It was there.
And now that I'm surfing the wave, the new research that pops up and clips to the old stuff, it's this whole domain.
Yeah.
And again, it's just got so much good news for patients. I can't imagine not, jumping into that
Yeah.
lake every day.
Yeah,
But
totally.
that's what, but this is what you and I love doing.
Yeah.
So, and we love the outcomes. I think that's the.
Yeah, totally. Yeah, I think it is really exciting to see somebody, transform their life in this way where there isn't this dependency anymore. There isn't dependency on a pill or on a doctor, or, it's that idea of spreading freedom and helping people be empowered to understand that stuff. And I know that, the things that I'm super interested in that I don't see talked about as much in the realm of whether it's conventional medicine or really, I don't know. I mean, functional medicine talks about it, but it often is focused a lot more on like gut health, for example, or adrenals or that sort of stuff. But for me, the PNI, the psychoneuroimmunology, is
Mm-hmm.
the most fascinating topic. And I don't know if that's just because I'm like such a emotional, like
Yeah,
sensitive,
unpack
intuitive
that for
person.
us. People are going to want to know what that word means.
Yeah, so psychoneuroimmunology is a field of medicine or healthcare or whatever. It's just a field that is looking at the connection between our psyche, so our thoughts, our things that are just going on in our mind, and how they impact our psychoneuroimmunology, how they impact our neurology, and then how that speaks to our immune system. And there's longer extensions of this, so like psychoneuroimmunoendocrinology or whatever, like it'll extend to other systems as well. One of my favorite mentors, Dr. Mario Martinez, he has like a whole one that's like psychoneuroendoanthropol, like he adds in the kind of anthropology part of it, which is so
Mm-hmm.
fascinating to me, like cultural
Mm-hmm.
impacts on health. But
Mm-hmm.
to sum that up, it's basically like our thoughts, our beliefs, our ideas can completely shift the way that our immune systems work, the way that our hormones are produced. So
Mm-hmm.
this is a lot to, I mean, probably one of the most common examples of this is where people are really understanding the benefits of gratitude and gratitude practices. So gratitude lights up certain parts of our brain. So gratitude, we could say first comes from our psyche. We're like grateful for something. And then it's going to light up certain parts of our brain in our insula and our limbic system. And when we light those parts up and we have gratitude for something, it also activates our empathy. So empathy for ourselves and for others. And what that does is actually very anti-inflammatory, and it will have this cascading effect of changing the cytokines that our body produces and the way that our immune system starts communicating with our own body. And this is just like this whole cascade of amazing processes that happen when somebody spends 5 minutes thinking about what they're grateful for, instead of 5 minutes being like, I'm going to die a horrible death, I'm cursed, I'm diseased, I'm broken, like these other ideas that we have a lot of times when we're concerned about our health. So that's kind of like the, one example of how PNI or psychoneuroimmunology has a very applicable practical outcome. And so that field and that approach is a lot of what I focus on with my clients, particularly ones who are sensitive and they just have mystery symptoms. They don't know what's going on with them, but they just have a lot of stuff. Or people who have autoimmunity, Hashimoto's, like whatever it is, like whatever autoimmune condition. When we start to really investigate like somebody's inner dialogue, I've like found that not only are sensitive or autoimmune people, like this group of people that I tend to work with, like not only are they like sensitive to their environment, they're like, really they pick up on other people's energies, or they're really intuitive, but often they have a lot of hypercritical self-talk. They're often perfectionists. They often have a hard time saying no, setting boundaries, these sort of things. And when we look at the implications of like saying no and boundaries, for example, like we can think about energetic or emotional boundaries and how that reflects to boundaries or barrier systems in our body, our gut barrier system, our lung, our blood-brain barrier. And so when there's degradation of one of these, the other happens often as well with people. So there's just this fascinating world of how we experience things kind of emotionally or psychologically that is also connected to how we're experiencing things in our body or physiologically. And so I love focusing on that because I found I'll mix my, sessions with people. Sometimes we'll just talk about like a lab finding and we'll go through that and be like, let's, do this or that with supplements or diet. And other times we just spend the whole session being like, what was this conflict you had with your partner or with a coworker, and how did you speak to them? What was your kind of
Treating a
psychological?
whole person. Yeah. All the
Yeah.
different dimensions.
Yeah. So that's fascinating to me, how our mindset and our, our thoughts, even our beliefs about what's possible actually impact the outcome of what's possible with our health.
There's two things that makes me think about. I love how you're articulating it because it's so clear. So those examples, I think people listening can immediately intuit then that a gratitude journal or gratitude practice would be a behavior that translates to success, or start turning around some of these mysterious symptoms, because these things are linked.
Yeah.
I think a lot of Americans are pretty data driven. So knowing that psychoneuroimmunology has studies, fair number of Americans, it's like the mechanic saying they ran the little computer chip diagnostic and the carburetor's not tuned. Like maybe maybe it'd be different in Tibet, but I think a lot of Americans are pretty data driven.
Yeah.
And then one of the books that had the biggest impact on me was The Molecules of Emotion by Candace Pert. And I'm dating myself here, but I'll just never forget her saying that she had this emotional journey of discovering the opioid receptor, getting sort of politically maneuvered out of the Nobel Prize. So now she's got this sort of horrific sense of betrayal, which then leads her into the research on peptides, 4 and 5 amino acid signaling molecules, as part of the path of healing.
Yeah.
And toward the end of the book, saying that it was really hard, but the type of research that it led her to, which was that the positive attitude and the types of things you're describing, gratitude and mindfulness, et cetera, turn on these signaling cascades cell to cell everywhere in the body, that things are getting better.
Yeah.
I just remember being blown away. I remember saying to my wife that evening, like, this book is just, this is incredible science. This is incredible journey. This is incredibly positive person. And to me, it sort of encapsulates how there's all these different layers and facets to people's journeys.
Yeah,
Some of
totally.
it's hard science, some of it's courage, some of it's grit, some of it's bad luck that seems like bad luck and then it turns into good luck.
Yeah.
It just
Yeah. And I think that what you're speaking to is like, teaching resilience in people, resilience in their, approach, like their psychological approach, but that reflects in resilience in our bodies and our health, our physiology. So, kind of really understanding how we handle stress, whether it's like little behavioral changes or mindset or practices that we do. It's all kind of like a microcosm or a macrocosm of that stuff. So the way that we do one thing is the way we do everything. So,
mm,
you know, um, I think about that a lot. But yeah, molecules of emotion is an excellent one. There's so many kind of really interesting looks and research into kind of data behind a lot of this stuff that has been really intuitive, has been really obvious to people who are intuitive, and
mhm.
starting to kind of quantify that a little bit. I can just think of so many books along those lines. I think Bruce Lipton is another one. He's Biology of Belief is a really big one where
Yeah.
he looked at things in petri dishes. I think he was like a microbiologist or something,
Mhm.
and started seeing connections there. I think even Deepak Chopra talks a lot about this stuff and kind of having like miraculous healing with people based on stuff that
Yeah.
we couldn't really measure a long time ago, but now they're starting to. And then when it comes to empaths and introverts and highly sensitive people, they're all slightly different, but like, what is it? Is it Judith Orloff? She kind of like talks a lot about empaths, and Susan McCain, she wrote Quiet, the Power of Introverts.
Mm,
These are all just books that just kind of like, as I got introduced to them, I was like, this is amazing. There's so much
yeah.
research and there's a whole field behind this.
Yeah.
Um, but there's so much to look at that, like people who are sensitive, who are highly sensitive or empaths or introverts, they do kind of experience the world a little bit differently. And so it's going to have a different impact on the way health or diseases develop. And also, it's something to actually consider in terms of the approach of when you want to reverse an illness or you want to
Mhm.
achieve better health. And so, with those assessments I do with people, I always kind of start out there and I find out, are they extroverted? Are they introverted? Do they like data? Do they like more experiential, intuitive approaches? And kind of matching a person with the things that are going to move the needle the most for them, I think is a really cool way of
Yeah.
thinking about like
Oh
really just
yeah.
finding this vitality that's accessible in so many different ways. There isn't like
Mm.
one answer.
Oh, it just totally lights me up getting to talk to you today. This is a blast.
Yeah, I love this stuff. And yeah, it's so great talking to people who, have this journey of like either personal health or like their clinical experience, seeing people's lives transformed. And
Mhm.
it's like, can't go back to the
No,
way you were,
no.
practicing before
No,
learning
once you've drunk from that well,
that
that's it. Well, how can people work with you, Dr. Natasha? How can they connect to your resources and work? If they check out this podcast, there'll be a way they can access your ebook, your
Yeah.
website.
Yeah, definitely. So on my website, it's just drnatashaf.com. I'm actually doing a really big overhaul to like provide a lot more free resources on my website coming up. So just like tons of these topics that I've talked about, I'm going to put a lot of the research and the PNI and the articles and all of that up there. But I have an ebook that I wrote about my healing journey, like the 5 things that I did to recover from anxiety, depression, and autoimmunity. And all of them are kind of from a very holistic, natural approach to things. And they include functional medicine and kind of a lot of this mindset work. So they can download that book for free on my website and kind of just have like an intro to all of this stuff that I'm talking about. But yeah, or find me on social media. I love connecting with people who are kindred
Nice.
spirits, whether
Oh,
they're,
yeah.
practitioners like you or people who are on their healing journey. It's that's been the most rewarding part of being in this position that I'm in is just finding other people who are finding this magic in the world of like how much potential we have.
Mm. Well, that's a great note to close on. And as I was looking at your website, that's the look and feel of it too, the vibrant pictures. And
Thank you.
so it's nice for me knowing people have a bunch of different ways that they can
Yeah.
follow up. So I just can't thank you enough.
Yeah, thank you so much. This was such a fun conversation. I really appreciate you having me on.
Have a good rest of your day.
You too.
Seaworthy exists for people to overcome their health challenges and be fully vital. Please consider subscribing, giving us a 5-star review if we've earned it, and going to our website podcast tab for any questions or comments you'd like to share with us. Thanks.